How to survive a heart attack alone after 60. 7 critical steps every senior should know. Have you ever stopped to consider what you would do if a heart attack struck and you were completely by yourself? It's a frightening scenario, one that happens more often than most people realize. Many assume they'll have someone around to help or enough time to respond. But in reality, those first few minutes are crucial, and what you do in them can mean the difference between life and death. The good news? Even if you live alone, you can survive a heart attack. All it takes is knowing what to do and acting quickly. In this guide, we'll walk you through 7 essential steps to take the moment a heart attack begins, especially when you're the only one around. No medical background is needed. No high-tech gear required. Just simple actions that can save your life. We'll cover how to detect early signs, what you should take immediately, how to ease the strain on your heart, and small but powerful actions that can give you the extra time you need. Stick with us to the end. The final tips are often the most overlooked but can be the most life-saving. Let's dive in. Step 1. Spot the early signs before it's too late. The first key to surviving a heart attack alone is understanding what it really feels like. It's not always the dramatic clutching of the chest you see in movies. Real-life heart attacks often start subtly. Instead of sharp pain, you may feel an unusual pressure in your chest, a heaviness or tightness, as if something heavy is resting on you. Sometimes the feeling spreads to your neck, jaw, shoulders, or arms. It might come and go or feel like indigestion, making it easy to dismiss. Other red flags: sudden shortness of breath, sweating without reason, lightheadedness, or extreme fatigue. Some people, especially women and older adults, may feel discomfort in their back or stomach instead of their chest. Consider Richard, aged 74. He was just sipping coffee at the kitchen table when he felt a strange tightness under his collarbone and noticed he couldn't take a deep breath. He broke out in a sweat, but there was no sharp pain. Still, he remembered reading that heart attacks don't always feel intense at first. He called for help, and that decision may have saved his life. Your body often gives quiet warnings before a crisis hits. Pay attention to those signals. Don't wait for dramatic symptoms. If anything feels unusual, especially a mix of pressure, shortness of breath, and fatigue, stop what you're doing and prepare to act. Step 2. Call emergency services right away. Once you suspect a heart attack, your very next move should be to dial emergency services. Don't wait to see if it passes. Don't call a friend or family member first. And whatever you do, don't try to drive yourself. Time is critical. The longer your heart is deprived of oxygen, the more permanent the damage. Calling 911 or your country's emergency number immediately ensures trained professionals are on their way with the tools and medication needed to keep you alive. Think of Linda, 78. She felt a wave of nausea and a strange ache in her shoulder. Instead of calling her son, she remembered a nurse's advice: call emergency first, family later. Paramedics arrived quickly, just in time. Had she waited, things could have gone very differently. It's okay if it turns out to be something else. Emergency operators won't be upset. They would much rather respond to a false alarm than arrive too late. Keep your phone within easy reach at all times, in the bedroom, bathroom, or living room. And familiarize yourself with your phone's emergency call features. Many smartphones allow you to call for help even when locked. Step 3. Chew an aspirin. Don't swallow it. After calling for help, your next step is surprisingly simple. Chew an aspirin. Not swallow, chew. A standard 325 milligrams tablet, unless contraindicated by your doctor, can significantly improve your odds of survival. Aspirin works by thinning the blood and helping prevent clots from growing larger. By chewing instead of swallowing, you absorb it faster, and those few extra minutes matter. Joe, 72, knew this. When tightness spread across his chest, he chewed an aspirin he kept in the kitchen drawer while waiting for the ambulance. Later, doctors told him that single act may have lessened the damage to his heart. Make sure aspirin is easily accessible in multiple places: your nightstand, kitchen, purse, even your wallet. Check the expiration dates regularly. Let your family know where it is, in case they ever need to find it fast. This tiny pill might be the difference between recovery and tragedy. Step 4. Sit or lie still and conserve your energy. After taking aspirin, resist the urge to move around. Don't tidy up. Don't pace. Don't unlock the door unless absolutely necessary. Instead, sit down or lie in a comfortable, stable position. Rest your back. Keep your feet flat on the floor. Avoid slumping or curling up. This makes breathing harder. The goal is to reduce the workload on your heart while you wait for help. Moving around only puts more stress on your body at a time when it needs calm. Alice, 81, felt tightness spread across her chest. She wanted to finish cleaning before calling for help, but she remembered her doctor's words. If you suspect heart trouble, sit down immediately. Everything else can wait. That decision may have kept her from slipping into cardiac arrest. Stillness is action in this case. It gives your body a chance to stabilize while help is on the way. Step 5. If you can, unlock your front door. If you have the strength, and only if it feels safe, unlock your front door so paramedics can get to you quickly. A locked door may delay them when every second counts. Breaking in is always an option for emergency services, but it wastes time and can cause unnecessary damage. Worse, you could be startled or hurt in the process if you're near the door. Paul, 76, managed to call for help, chew his aspirin, and unlock his door before sitting down. Paramedics later told him they reached him faster thanks to that simple move. If you're too far away or too weak to walk to the door, don't push yourself. Stay seated and conserve your energy. You might also want to explore smart locks, medical lock boxes, or giving a trusted neighbor a spare key in advance, just in case. Step 6. Use speakerphone and set up a medical ID. Your phone can be a lifeline during a medical emergency, not just to make a call, but to communicate critical information. Once you've contacted emergency services, switch to speakerphone. This allows you to talk hands-free and conserve energy. It also lets dispatchers hear if anything changes, your breathing, movement, or tone. Even more important, your smartphone likely has a built-in medical ID feature. This allows first responders to access key health information from your lock screen. Things like allergies, medications, emergency contacts, and medical conditions. Susan, 79, collapsed before help arrived. But because her phone had her medical ID set up, paramedics instantly knew she was diabetic and allergic to penicillin. That information guided their care and possibly saved her life. If you haven't set this up yet, take 5 minutes to do it today. It could be your voice when you no longer have one. Step 7. Breathe slowly and stay mentally focused. In the middle of a heart attack, fear can overwhelm you. Your mind races. Your breathing quickens. But the one tool you still control is your breath, and it's more powerful than you think. Deliberately slowing your breathing can calm your nervous system and help your heart maintain a steadier rhythm. It won't stop the heart attack, but it may prevent things from spiraling into full cardiac arrest. Try this. Inhale gently through your nose for 4 seconds. Hold for 1. Exhale through your mouth for 6 seconds. Repeat. Focus only on that rhythm. Frank, 83, felt panic creeping in with every beat of his heart, but he remembered a breathing technique his doctor once taught him. He used it, and it helped him stay conscious until help arrived. Practice this breathing even when you're not in danger. Make it a habit so your body knows what to do in a crisis. Final thoughts. You're not powerless, even alone. Surviving a heart attack alone isn't about chance. It's about preparation and presence of mind. These 7 actions, recognizing symptoms, calling for help, chewing aspirin, sitting still, unlocking the door, using your phone wisely, and breathing slowly, can buy you time and save your life. Each step sends a clear message. You may be alone, but you're not helpless. So ask yourself, which of these actions are you ready for today? Which ones do you need to prepare for? Maybe it's adding aspirin to your nightstand. Maybe it's setting up your medical ID or showing a loved one where your keys are kept. Whatever it is, do it now. The best time to prepare is before you need it. Share these tips with others, too. The life you save might not just be your own. Thank you for spending this time with us. We hope it empowers you with knowledge, peace of mind, and a plan you can count on.